really know everything there is to know about Invisalign. I mean, you might think you do. And if you watched our last episode right before this, episode number 24, which we're starting out talking about the top 7 things that you need to know about Invisalign. Well, we're going to continue that conversation. I'm Laura Lewis Edwards. I am Dr. Jill Wade's co-host, health and beauty expert, and I'm passionate about everything that's health and wellness. And this falls in alignment. Get in alignment.
Oh, ba-boom.
Thank you, Dr. Jill, for having me here. I mean, in our last episode, we talked about the 3 essential things you need to know about Invisalign. But today, and in this episode, we're going to reveal the final 4 things that you need to know, these facts you need to know about Invisalign. And it's a little bit elusive if you really don't know about it. So, Dr. Jill, hello. Let's dive in and talk about those final 4 things you really need to know about Invisalign.
Oh, fantastic. I'm excited about this. I love Invisalign. It's such a fun, cool service that we provide at Stonebriar Smile Design. And hopefully we're going to just be able to share things that answer some of your questions that you may have been sitting around wondering if it was the right type of treatment for you, or how hard is it, all kinds of things. We want to try to answer it. I just want to say that in our last episode, we talked so much about how Invisalign has such great benefits, not just for cosmetic reasons, but for overall health and wellness. And it really is one of the reasons why I'm always saying out there, like I'll sign letters and I'll say things all the time. And I keep saying, like, keep smiling from the inside out. And what I mean by that is when you are super confident about your smile, first of all, when you smile, like, your whole face lights up, right? When you're confident and you're smiling and you're proud of it, right? So I hate seeing when people have beautiful teeth, like really beautiful teeth, but maybe they're just not quite in the right position. And I can see the potential that those beautiful teeth could just be moved around in so that it creates this really dynamic, amazing smile. And so that's why I love to see Invisalign so much. But what I also mean by smiling from the inside out is that I also know that when they're in the right position, they're just so much healthier down the road. The teeth themselves, the wear, the tear on them is so much better when teeth are positionally properly positioned, but also because we have your mouth in the right design, I'll say design, for you to be able to breathe better or your best. And then because of that, you will typically sleep better as well. So all these things come into play. It's not just about cosmetics, although that's a really fun part and piece of it, but it's also about the overall health and wellness benefits too. So I don't mean to belabor that point, but I really did want to hit that home for you guys because I think it's so important and one of the reasons why I do love it so much. So start me off on what number 4 was. I think we did 3 topics last time and we've got number 4.
Yeah. We've got the final 4 of everything you need to know about Invisalign, but we're afraid to ask. I'm just kidding. It's like the top 7 things you need to know about Invisalign. And so our number 4, and this is a big question. Now, I've heard, and 2 of my kids had braces. I didn't have to have braces. I was lucky enough. I did not have to have them when I was growing up. But I know my kids went through a lot of discomfort.
Oh.
And does Invisalign hurt as much as traditional regular metal mouth braces with the rubber bands and all that good stuff?
Well, I'm excited to tell you that it does not. It does not hurt as much as traditional braces. And I'll tell you a couple of reasons why. When you start traditional orthodontics, the brackets and the wires, you typically have to put little spacers in some of the back molars to literally push them apart so that bands can be placed around those teeth. Not everybody's technique has that, but man, anybody who's had spacers before knows that that can be super painful for a week or 2. Like, it's intense. So Invisalign does not need spacers, so that's good. The other thing that people don't always realize with traditional braces is because you can really I hate to use the word crank, but I'll say crank. You can really crank some really good tension on teeth that need to move a long way. And that is through the power that the wires have on the brackets themselves. So you'll get a really powerful, when you go into the dental offices, you'll get a really powerful pull or tug on the teeth to get pulled into the right direction. And that will last for about a week. Then you'll have a couple of weeks, maybe 2 to 3 weeks, where it feels okay. And then you'll have another tug. Well, that tug is what's actually moving the teeth. And then the couple of weeks where it's pretty comfortable is when it's just settling in. And then you'll tug again. And then, so that little tug is pretty, I'll say painful, sensitive. It's intense. Well, the difference with an aligner type of orthodontic movement is that it's a gentle, constant pressure. And because of that, your teeth are literally moving all the time a little bit. And one tray, when you move into the next tray, it's another gentle, constant pressure. And so you don't end up with these really big tugs where we create a ton of soreness and then a relaxation. It's just a constant, gentle pressure. So I truly say it's more like a sore muscle. It's not like a pain. And typically, we have some tips and tricks where we say, we want you to change your tray at night before you go to bed rather than first thing when you get up in the morning, because typically the first 12 hours or so that you wear your new tray is going to be when you have a little bit more pressure. And so you're asleep. And so you don't even notice it. So you really kind of have like maybe one day that you might notice a tiny bit of soreness. The rest of the time, very, very comfortable. And I hear this constantly by my patients. They're like, the first time they come back in the office, I'm like, well, is it better than you thought it was going to be? Is it easier than you thought it was going to be? And like all the time, I get the answer, yeah, it's a lot easier than I thought it was going to be.
Well, especially when you put it the way you were describing with the metal braces approach, where it's a big tug, and then they get to relax a little, and a big tug. So it's more uncomfortable, like, uh-oh, I got to go again and get them adjusted. Whereas this is a slow, gradual process. Right. And speaking of that and the gradual process, because I really didn't know about this, about Invisalign, about how it really worked. And this comes to the trays. And the question is, how many trays am I going to get if I'm going to go in and get Invisalign and I want my teeth to move and I want that perfect, healthy smile? Tell me what's involved with this. Right. How many trays am I going to get?
You know, everybody is unique and everybody is different. And so it really the trays themselves and how many you're going to have is dependent on how, I'm going to say challenging. I think that's a good word. How challenging is your case? How much movement do we have to move? Are we really, have we never gone through braces ever before and we really have some constriction, a lot of turns, a lot of visible, crowding? Or are we looking for we've had braces maybe before, we didn't wear our retainers, so we have some relapse. We have 1 or 2 teeth out of place, a little bit turned, and wish it was a little bit more back in alignment. So those 2 cases are kind of the extreme. So we have, everything from light cases, which is about, could be anywhere from 7 to 14 trays, to much more complicated cases that might be, 20, 30, maybe even 40 trays before it's all said and done. So there's a wide range of how many trays, which basically is the same as telling me how much time you're going to be in treatment. So basically, this is what I do. I will see a case and I will start to calculate in my head, how many trays do I think it's going to take to make the movements or the changes that I'm visualizing? And then I count in my head, how many trays is that? And in my practice, as long as somebody's truly committed to wearing their trays both day and night for me, taking them out to eat, taking them out to brush their teeth and things like that, maybe a little bit, like if they have a special thing that they want to go to, leave them out maybe an hour here or there, but for the most part, they're committed to wearing them day and night, then I consider that one tray is going to equal 1 week. And so therefore, I can really calculate how much time that somebody's going to be in treatment. So let's say it's 14 trays and that's 14 weeks. I usually give myself an extra 2 months, because if there's anything that didn't want to quite move to where we wanted it to move in the final position, then I can do a refinement, make a couple more trays, and get that one last little stubborn tooth to get right into place, so that we can be not just good, but perfect in the end. So I hope that answered that question.
No, it did. And because you talked about, I think it was in the last episode, maybe earlier in this episode, but how you will go after you see the patient, you do your digital, you scan with the iTero, as well as take the pictures and things like that. Then you go and you consult with the doctors at Invisalign as well to come up with this plan. But you already know, you do this so much. I know you're probably spot on with what they're doing as well, what their recommendations are. But you know what is so interesting, Dr. Jill, is that the human body, I think it's just amazing how you can say, we're going to move these teeth, and we're moving teeth and bone, we're going to move things around, and then we're going to make you, stay in a healthier place. And I know we'll talk about how you keep it there in a bit, but isn't it just amazing though for you to see this happen with your patients, to go from point A to Z in this whole process with their smile and their teeth?
It is so fun. And I think too, one of the things I love about this particular technique is that I don't think you can really appreciate when you're in the middle of traditional braces. I don't think people can always appreciate the journey. Like, from the very get-go, from the very first week, the journey has already begun. You're getting to that beautiful smile in the end. But in traditional braces, you're not really able to appreciate it or to kind of visualize what is happening, because there's just so much hardware in there, right? With Invisalign, what I find so fun is that from the very first week, maybe give it 2 to 3 weeks, like, there's visible changes that not only you are seeing in the mirror, but everybody else that sees you is seeing on you. And you're literally seeing the changes in real time. So you're not waiting until this final product, 14 weeks down the road, or 6 months down the road, or 8 months down the road. You're literally getting to visualize this process, this journey of, creating your new broader smile, for lack of a better way of saying it, literally right in front of you. So it's super motivating. It's kind of like losing weight, honestly. Like, if you are losing weight and you look in the mirror and you see it, it's even more motivating for you to continue with your healthy eating plan or your exercise plan, because you're instantly seeing the results. That's why I feel like Invisalign is also such a great adult service, is because you're getting instant feedback almost within 2 to 3 weeks of something moving into the direction in which you want to see it go. That's super motivating.
I would imagine. I would totally imagine that. So next, number 6 on our list. So we already covered number 4, which was, does it hurt? Number 5 was, how many trays will I get? And number 6 is, how long does it take? And how much does it cost?
Wonderful. So I kind of, I guess, spoiled this one a few minutes ago, because I kind of said how many trays. So again, it's kind of, are you light to comprehensive? That's how many trays you're looking at. Basically, that's also saying, okay, I'm going to be in this 6 months. I'm going to be in 8 months. Possibly, I have some patients who've been in it for several years because they were a very challenging case. They knew that we may not get as ideal of movements as we might have in traditional braces, but they completely knew for a fact that they'd rather have close to perfection and were okay with a little bit less, because they wouldn't have done anything if they had to gone into traditional braces as an adult. So
the amount of time equals the amount of trays. And like I said, most of our cases I see the most are somewhere between, I'll say 10 to 20 trays. So that's the average in my office. And then you said, how much is that? I believe is how you said that. So
Well, yeah. Well,
yeah,
like I know that we touched upon this, where how long does it take?
yeah,
That because if someone has, let's say someone has 20 trays, and but they only will wear them at night. They don't want to wear them during the day, or
right.
vice versa. And I know you mentioned that,
Mhm.
well, that's their choice,
That is
right?
their
Regarding
choice.
the length of
And it
time
will
that they'll be
still
wearing them.
work. It will still work. So,
Mhm.
but I have to have people be honest with me when they come into the office. If they tell me, say, hey, I want to do this, but I have no intention of wearing them during the day, that's fine. It's a matter of time and pressure. We just need to go in and I tell them, no problem. It's still the same amount of trays. It's just going to take you twice as long. It's
Right.
not a
There
problem.
you go.
But I want you to
Not
be
a
honest
problem.
with me, because this is a partnership. It's not a
Yeah.
dictatorship. It's a partnership. But you got to be honest with me and let me know what we really have going on. Now, the other cool thing
Sure.
is I don't charge you extra because you decided you're only going to wear them half of the time. It's based on the
Mhm.
trays, and it's based on the amount of times that I need to see you. Okay. So if it's going to take you twice as long, I see you the same amount of times. It's just more time in between the times that I see you, if that makes sense. And so
Sure.
typically our cases in Invisalign range anywhere from 4,000 to about 6,500. And so that's very normal. That's a very normal orthodontic type of value.
And am I able to, if it's $4,000 to $6,500 as one of your patients, do I have any financing options, or is it
Oh,
just putting on a credit
absolutely.
card? Is there like care credit, or
Absolutely.
you
We
guys
have a
do that?
ton of our patients use third-party
Uh-huh.
financing, and I think it's a super smart reason for them. They're going to be in treatment for, multiple months. So why not utilize somebody else's money, basically, to allow you the ability to pay on it per month? And so I highly recommend that to most people. Of course, you can use your own credit card. You can use your own HSA. We have a lot of patients who will utilize some of their HSA benefits to do Invisalign. And I think that's really smart as well.
Super smart. All right. Well, final number 7 of the top 7 things you need to know about Invisalign is, when I'm done with my trays, can I just like walk away and I'm all perfect for the rest of my
Oh,
life? Or do I have to do something else
yeah.
to keep them?
I'll be honest with you. I wish I probably had a different answer for you, but I am a super big believer that it's retainers for a lifetime. And I really, really wish that, well, I'll just tell you this. There's so many people that walk into my practice who either move on towards Invisalign or say they wish they would do Invisalign or could have Invisalign. And one of the main reasons that they tell me is that I've had orthodontics when I was younger, when I was a teenager, or when I was a young adult. And they either didn't tell me that I needed to wear my retainers forever, or when I lost them or the dog ate them, I didn't get them immediately replaced. And by the time they were going to either get a new set or get some new ones made, that things had already shifted. And because of that, then they were back into the need of needing to go back into some type of orthodontics. Okay. So I am a huge proponent for retainers for a lifetime. And I'll tell you 2 reasons why. One is because you want to keep that overall arch as expanded as possible. And with time and gravity, it is very natural to get your mouth to want to collapse on the sides. And you won't see this. You won't appreciate this until it's too late. You'll either see it in a decade later, photograph, that your smile just doesn't look as broad as it used to. And it's because it constricts from the side and everything wants to go down and forward with gravity. It wants to follow gravity down and forward. And so what do you think is going to be the teeth that are going to twist and turn first because there's less space or less room? It's going going to be the front ones. And typically, the very worst ones to do that are the lower ones. And so when I want to, on a movie or somebody that I'm meeting for the first time and I want to know how old they are, that's where I look. I look at their lower front teeth, because if they're really super crowded, then they're likely older and have had more gravity pull, if that makes sense. So the way to defy gravity, if you want to say, is to wear your retainers and keep that arch really full. And the other wonderful thing about that is, because it's going to be plastic on plastic and you're going to touch plastic on plastic at night because of the retainers, then you can sit and grind, clench, tap, lay on your side one way or the other, and you're not going to wear down your teeth. You're not going to wear down your fillings. You're not going to really be sitting there chomping around on crowns and things that you've invested in. You're protecting your investment that you've already made on the dental work that you've already got in your mouth. So retainers, like, why not? Like, I guess that's my question. Why not? It's so easy. They're not big. You're already used to them. So it's retainers for a lifetime for me.
Right. And I think I love that you used the word gravity, but you also didn't use the term getting older.
No. We just
Aging,
get better.
Getting older really is gravity. What really it is, as we've talked about anti-aging and cosmetic dentistry in other episodes, and just what happens, just that's a fascinating thing. It blows my mind, because you are so wellness oriented and you know all this about what happens to the anatomy of the teeth and the mouth and the jaw and the bones and everything else as you get older. So I think the selling point for me would be the why not wear a retainer after your investment, you're protecting your teeth and all that, but also keeping my mouth, my face to look more youthful as I age, and which is going to also keep me healthier.
Right.
And so I really like that. And I think there are a lot of people in my generation that we want that. We want to have that vitality. We want to have that health. We want to have the quality of life till the end of our lives. And I think this is a great thing, a great investment in Invisalign, and wearing that retainer is the most perfect thing that a person can do.
I absolutely agree.
Awesome.
I'll make one other little analogy. So why do you get crowns in the first place on teeth? Because you're breaking them, or you're cracking them, and you're trying to get a crown on it to, kind of like a baseball cap, to come around the tooth and hold it together so that it doesn't break. Okay, that's why we get crowns. So if that same concept, if you imagine your retainers down on your teeth, and especially on your back teeth, that's what they're doing. It's like putting a baseball cap, not just on one tooth, but on all the teeth. And it's sitting there and it's supporting all of your natural teeth, all of your crowns, all of your filling, everything. And it's around them and squeezing and holding and protecting them. To me, it's like an insurance policy. It's the best way to keep you from having to invest in more crowns, break something, and then have to invest in an implant and a crown on top of that. So it's, again, the question for me is, why not? Why not?
Why not? Because that's a big investment. If you've never broken a tooth and had to have a crown, that is an investment that it's significant. And so being able to maintain your investment over a long period of time this is just the perfect thing to do.
And that's why we talk about these types of things here on the Beyond Face Value show. There's a reason why we talk to you about the money, and we're not afraid to tell you what the investment is, because you're going to pay now or you're going to pay later. Like, is that not true? It's same thing with a car. You're going to pay now or you're going to pay later. You're going to get a new set of tires now. You're going to rotate your tires now, or you're going to have a blowout and you're going to get 4 new ones.
Right.
Same thing.
Right. Exactly. Well,
Same
this has
thing.
been so fun and so interesting. And I never thought I'd be so excited about something like Invisalign. I really didn't. I had no idea, but I am. And this has been super fascinating. And if you are just seeing this episode or listening to this episode and you haven't heard our first 3 that Dr. Jill talked about all about the top 7 things that you need to know about Invisalign, go back, look for it on Dr. Jill Wade's Stonebriar Smile Design, the Beyond Face Value show. on the YouTube channel there, as well as look for the Beyond Face Value show on your favorite podcast streaming platform. And there's a bunch of episodes in there that we think you'd really enjoy. Tell people about it. Tell people about this is a cool show that we talk about all things wellness and really rooted into Dr. Jill's background and her passion about treating this whole individual. And it's not just about your teeth. It's about everything, isn't it?
Absolutely. Absolutely. Well, thank you, Laura, for having this great conversation with me today. And hopefully this has answered some great questions that people might have out there about Invisalign.
Thank you so much for having me. Can't wait till next time.
Absolutely. Thank you.
Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platform such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.